Hi there, and welcome to the Patient Better Project, a family health communication and management program designed to help solve leading challenges that are facing home care today. Let me explain. But first, let's go into the history and address why we were established. In 2012, the U.S. Census Bureau showed that the aging population was growing, and the need for home care was projected to grow at a breathtaking pace from 2021 to 2031. The U.S. Bureau of Labor Statistics also predicted that home care will increase by 21% and add over 700,000 jobs each year over the decade. Indeed, based on the aging population, home care executives saw an expansive future. And moving forward to 2018, Home Health Care News shared a positive outlook with executives, but stated that in order for home care to make a significant impact, the following factors would need to be implemented in addition to already offered services, such as improving payment models, apply more shared risk options with payers, enhance caregiver quality, become a more effective liaison in healthcare communication, as well as practice greater integration and collaboration with health professionals and transitional care service providers. However, the question remained, how can home care obtain these last qualities while remaining on a budget? And once the pandemic hit, there was a surge in home care needs, as many people realized that these services played a more significant role than was previously believed. And despite the uptick in service need, many people, including potential referrers, still didn't entirely understand home care's robust service offering, thus leaving many people without the necessary help to perform activities of daily living or manage their health conditions properly. The results of people being uninformed about home care services turned devastating and led to premature living transfers, conditions advancements, and a more rapid decline in mental health. Identifying the incredible need, the Patient Better Project formed a nonprofit organization to help Americans become more knowledgeable in care. And our research showed that home care can potentially play an important role in helping people. However, they were up against challenges that were preventing them from implementing a communication tool that would not only advance their company but also help people maintain their livelihoods. And so we created a family health communication and management program to help home care companies play a more intricate role in people's lives. Our vision is clear, and with our 501c3 nonprofit status, we can more easily elevate home care by helping them become a more necessary senior and family condition management leader, a stronger communication liaison, as well as a more dynamic transitional care coordinator, thus allowing their clients and families to focus on more important things like preserving relationships as well as maintaining their lives. Our home care partners enjoy a measured overall 42% in net revenue increase in private pay clients, improved referral base, and kept clients on the books for longer. Have a clear pathway to achievement in professional communication, transitional care interaction, and staff retention efforts. A 98% success rate for participating home care companies within the first 6 to 12 months of signing on, and the ability to get their company to run itself while supplying a more robust offering with minimal effort and sacrifice. To get started, simply email us at info@thepatientbetterproject.org or call us at 866-205-2309. Thanks for watching.